It's a problem that affects about 26 million women in the United States, but uterine fibroids are often not talked about or properly treated.
Now there's a renewed legislative effort to educate people about this issue and make much needed advances in research. Jonelle Henry was diagnosed with fibroids a few weeks before her 40th birthday. She didn't know what they were and says it was a confusing time.
What I did realize was that it could affect my fertility and it could affect just my quality of life. And so I started studying about fibroids.
Uterine fibroids are the most common non-cancerous tumor or growths in women of childbearing age. Black women in the U.S. are up to 3 times more likely than white women to develop uterine fibroids. There are medical and surgical treatment options, including a hysterectomy or a myomectomy, where surgeons remove the fibroids but not the uterus.
I wanted to preserve my fertility options, and so I decided to have a myomectomy 2 years after that diagnosis. And that was a long healing process, but I had a fantastic team.
Henry is director of programs for the White Dress Project. It's a nonprofit created to support women with fibroids, named for the color many fear to wear because of the risk of heavy bleeding.
We are going to be empowered by this color, and we're going to take back control of our bodies and really advocate for the things that we need to do to have the quality of life that we deserve.
Last month, the White Dress Project joined several other advocacy groups in Washington for a roundtable hosted by New York Representative Yvette Clarke and some of her congressional colleagues. Clarke is sponsoring a uterine health legislative package.
This is a nonpartisan issue because it affects women across the spectrum. Black women have a higher prevalence, but it doesn't mean that we're the only women that are experiencing this.
Clarke and one of the bill's co-sponsors, Representative Shontel of Ohio, both struggled with fibroids for years.
Too many women have dealt with this in silos and in silence. And we want to break the silos and the silence and the stigma around this issue.
Clarke's legislative package is comprised of 4 bills, including the Stephanie Tubbs Jones Uterine Fibroids Research and Education Act. It honors the late Congresswoman who first introduced the bill in 2001 and calls for more research, funding, and increasing education and training for medical professionals.
We need a generation of OBGYNs that understand exactly what this means to women's bodies.
I think that we are making tremendous progress, normalizing the conversation. This is something that happens way too often, and it deserves to get some greater understanding around the cause, the cure, and more treatment options.
And just to give some perspective on how widespread this problem is, over 1/3 of hysterectomies performed in the U.S. are done because of fibroids.